Structural therapy has very clear definitions of family, health, and dysfunction. It offers very clear guidelines for what a therapist should look for when intervening, how a therapist should intervene, and to what ends. It is a positivistic model in the truest sense. As such, it often gets criticized as being too disrespectful and forceful, privileging therapist expertise over the client's own wisdom, reflecting stereotypical gender roles and dominant cultural norms, and so forth. If you were a structural therapist purist, how would you respond to these critiques? To respond to these critiques, I think it's crucial to understand the backdrop in which this family theory emerged and why it was developed in the first place. Salvador Minuchin laid a foundation for structural family therapy approach while working outside New York City at the Vilfic School for Boys in the 1960s with colleagues, Montalvo and others. They worked with poor, low-income families, single-parent families of delinquent teens, and found that individual psychotherapy techniques were inefficient with this population. This population was disorganized. They were devastated communities that were confronted with social problems at the time. They were fractured and they could barely hold it together. That Minuchin and his team, out of their noble intentions, wanted to help organize these families. So they helped them organize and put some structure into these families so that they could function. And out of that came a form of therapy that was very present-oriented, in the sense that they were dealing with the here and now, dealing with the concerns that they wanted help with. And with their exposure to the poor communities, they were forced to pay attention to structure that they would have ordinarily taken for granted or ignored. So, as the name implies, they focus on family structure. And what does this mean? Minuchin looked at subsystems. Subsystems, he says, are the building blocks of a family structure. This could be a subsystem that is characterized by generation, by gender, by interest, by function. So there can be a sibling subsystem, a parental subsystem, couple subsystem, parent-child subsystem. There can be other sorts of subsystems. Those are the basic parts, and then they look at boundaries between those parts. Are they too close? Are they too distant? They also look at hierarchies, alignments, and power and coalition. How does power move? Is it static? Does it move from one person to another? Does it move from one subsystem to another? So they're looking at the family structure and making sense and interpreting and looking at how the presenting problem is related to this family. And in terms of approach, it's a very active approach. It's a very dynamic one. It's a therapy that demands that the therapist get involved. Because if you just sit back, in all of the chaos and confusion, you will just get swept in the turmoil, as Aponte said. You have to be very active so that you can engage with people in such a way that they can focus, that they can organize, and they can mobilize themselves into action to making something happen. Minuchin had a very particular way that he joins the family system. He calls it joining and accommodating, that he moves in such a way that he would talk with them and talk like the family rather than the family moving or talking like him. So he adapted to the family. He called it mimicking the family. The juicy part of structural family therapy, which I find is the most influential in the field, is the concept of boundaries. So he says boundaries are rules for managing physical and psychological distance between family members. So how close of distance we are and how that's going to look into this family. And so it really just is, it really just defines closeness, distance, hierarchy, family roles, and everything. And they're very organic. It's very important to understand that all boundaries are culturally defined. And so it's not like all members of the family have the same exact set of rules and boundaries, very, very much. So it's very, very important. You really can't separate culture from what healthy boundaries would look like. And so he says, Minuchin says that clear and flexible boundaries help maintain the functions of the subsystems by describing who participates and who does not. If your family is too diffuse or too rigid, that would lead to confused relationships and roles between family members, which could inevitably cause some alignments and form coalitions that cause imbalance in the hierarchical power structure of the overall family system. So in contrast to earlier theories, symptoms are viewed in terms of family's interaction, internal organization, or structure. Structural therapists attribute individual symptoms to the overall dysfunction of the family structure and believe that the primary therapeutic goal has been achieved when the family learns to restructure itself by creating boundaries that are clear and more flexible. At the heart of the controversy that surrounds structural family therapy lies the opinion that it is too forceful and confrontational. I would argue that it is not so. In fact, by joining and accommodating, the therapist is moving into the family structure, immersing himself in the family structure, mimicking and trying all sorts of stuff to understand the culture of the family. Because only then can the family be able to give directives, to suggest solutions for the problems that they're raising. In response to the critique that structural family therapy model fails to address some gender issues and cultural dominant norms, I would say that it is not so. In fact, structural family therapy takes into account culture very much. When assessing boundaries, we see boundaries in different definitions. A collectivistic culture will have a different healthy definition of boundaries as opposed to an individualistic culture. It also takes into account power and alignment and who has more influence over another person, who has how much influence that person have. The therapist also takes into account questions like what is this person's role, and am I going to support this role? Am I going to support this power in relation to that other person? It does take these things into account and balances them. In fact, he says the important thing about boundaries is that it is clear and it is flexible enough to be able to make some changes. Aponte even said that when dealing with families, you can't take out culture. You can't take out their values. They can't take out their beliefs. These are what forms them. These are what shapes their experience. These are what gives them meaning. In response to the critique that it privileges therapist expertise over the client's own wisdom, you have to understand that this therapy requires a lot of engagement from the therapist. You have to be constantly active, engaging the families, to organize, to engage them, to mobilize them into action. So yes, it can appear forceful. It can appear disrespectful. It can appear that it privileges therapists' own wisdom over the clients, but in essence, it really does not, because what the therapist does is just joins the family, immerses himself into the consciousness of the family, to the values, to the culture, to the beliefs, etc., and then helps the family helps the family solve the symptom, solve the problem, and see their structure, see what's going on. And as soon as some structure is established, then the therapist gives back that power to the head of the family, to whoever is the head of the family. As Aponte pointed out, it's not a comprehensive therapy. It doesn't include all the things that we need as therapists to be effective. It doesn't even have a theory of family or a theory of personality. But what does it give us is a vision where hopefully we can find a certain insight into how people work. But it's just a small piece of knowledge. And if you get stuck into the mechanistic techniques, then it's not going to work. It's going to be mechanistic. In fact, he says that it's important that people who want to be therapists have to plumb into the very depths of their own humanity and learn how to work with that in therapy, and to learn to, as it is to learn the theory and techniques. You cannot come in empty. You have to bring your own consciousness, your own beliefs, your own culture, your own soul to it, and immerse and then hopefully connect with the family soul, and be able to work with something. And in that, I think it's very humanistic in nature, and I think that's the saving grace. That's saving grace of structural family therapy.